Postpartum hemorrhage, PPH, is the leading cause of maternal mortality worldwide, representing 20% of all causes of mortality, resulting in over 80,000 deaths per year. 14 million women are impacted by this condition each year, which can include further surgical interventions such as hysterectomy, and FIGO have made clear statements on the need to reduce PPH using clinical and cost-effective interventions. With 10 years of proven clinical efficacy, Celox Pph provides a fast-acting, versatile and easy-to-use medical device offering a unique, innovative solution to address these global challenges. After a baby is delivered, the uterus typically contracts to push out the placenta. These contractions put pressure on the placental bed blood vessels where the placenta was attached in order to stop the bleeding. If the contractions are not strong enough, the placental bed blood vessels continue to bleed, resulting in more blood loss and postpartum hemorrhage. When PPH does not respond to conservative management, Celox Pph can be applied vaginally to rapidly help control bleeding. Before using Celox Pph, ensure all placental tissue, blood clots or membranes are removed from the uterine cavity, and with the aid of a speculum, grasp the cervix with an atraumatic instrument. Then manually insert the unfolding Celox Pph into the uterine cavity with the forceps at the uterine fundus. Cover the uterine wall and pack the uterus to ensure adequate pressurization. Transabdominal ultrasound can be used if available to aid accurate insertion to ensure the device reaches the site of bleeding and to minimize the risk of damaging the uterine wall. If ultrasound is not available, use external manual abdominal palpation. Celox Pph is a unique, fast-acting hemostatic gauze incorporating a patented chitosan derivative in the form of Celox granules. At the site of bleeding, when the positively charged Celox granules attract the negatively charged blood cells, they absorb fluid, swell, gel and concentrate platelets to form a robust mechanical gel-like clot that plugs the bleeding source. The Celox Pph gauze exhibits a level of mucoadhesion to the surrounding tissue, which keeps the gel clot in place. By creating a physical barrier and through the activation of platelets, Celox Pph stops the bleeding and reduces the risk of rebleed. Studies support that Celox works independent of the body's natural clotting cascade and has been shown to work even in the presence of clotting dysfunction. A sufficient length of Celox Pph should protrude through the cervix and vagina to be noticeable and to allow subsequent removal. Leave in place for up to 24 hours and remove by pulling the end left outside of the vagina. Evidence and extensive clinical experience demonstrates that Celox Pph provides rapid and effective control of uterine postpartum hemorrhage. 100% hemostasis for grade 1 and 2 bleeding, 95.6% hemostasis for grade 1 to 3 bleeding, 78% reduction in hysterectomy rate versus standard of care. Fast-acting, safe, clinically effective, versatile and easy to use at every delivery across the world.